Đó chị mới bông. Nhìn xác rồi. Chịu khó xíu em ha, con sắp xong rồi. Tuần sau lại em nha. Muộn nhiều lắm em chịu khó chút rồi chơi. Rồi. Để vậy cho đỡ mỏi ha. Chào em nha.
Welcome to this calm, peaceful moment. Take a deep breath in and gently release it. Today we're going to explore two different approaches to exfoliation, physical and chemical. Both can be effective, but they work in very different ways. Understanding these differences will help you choose the method that's right for your skin, your lifestyle, and your goals. There's no single correct answer, only what works best for you. Let's begin by understanding what exfoliation is at its core. Exfoliation is the process of removing dead skin cells from the surface of your skin. Your skin naturally sheds these cells continuously, but sometimes they accumulate, leading to dullness, rough texture, and clogged pores. Exfoliation helps accelerate this shedding process, revealing fresher, brighter skin underneath. The key difference between physical and chemical exfoliation is how they accomplish this goal. Physical exfoliation uses manual friction, scrubbing, rubbing, or abrading to physically remove dead cells. Think of it like using sandpaper to smooth wood. You're mechanically buffing away the rough outer layer. Chemical exfoliation uses acids or enzymes to dissolve the bonds holding dead cells to your skin. Think of it like using a solvent that loosens glue. The cells can then shed naturally without scrubbing. Let's explore physical exfoliation first. Physical exfoliants come in many forms: scrubs with granular particles, sugar, salt, jojoba beads, coffee grounds, cleansing brushes, konjac sponges, washcloths, exfoliating gloves, and microdermabrasion tools. The main advantage of physical exfoliation is immediate gratification. You can feel it working right away. Your skin feels noticeably smoother instantly. There's something satisfying about that immediate textural change. Physical exfoliation is also straightforward to use. You don't need to understand pH levels or wait times. You simply scrub and rinse. The simplicity appeals to many people. Some physical exfoliants provide gentle, effective exfoliation. Konjac sponges, for example, are incredibly gentle and perfect for sensitive skin. Fine. Round jojoba beads provide smooth exfoliation without harsh abrasion. These gentler options can be excellent choices. However, physical exfoliation has significant drawbacks that you need to understand. First, it's easy to over-exfoliate with physical methods. That clean, smooth feeling can be addictive, leading people to scrub too hard or too frequently. Over-scrubbing damages your skin barrier, causes micro tears, and leads to irritation, redness, and sensitivity. Second, many physical exfoliants are too harsh. Scrubs with irregular, sharp particles, like walnut shells, apricot kernels, or salt crystals, can create micro tears in your skin. These tiny injuries compromise your barrier, allow bacteria to enter, and can lead to inflammation and infection. Third, physical exfoliation is uneven. You apply more pressure to some areas than others. You might over-scrub your cheeks while under-scrubbing your forehead. This inconsistency can lead to uneven results. Fourth, physical exfoliation isn't ideal for sensitive, acne-prone, or rosacea-prone skin. The friction and pressure can aggravate these conditions, causing more inflammation and problems. Fifth, physical exfoliation only works on the surface. It cannot penetrate pores, so if your main concern is clogged pores or blackheads, physical exfoliation won't be very effective. Now let's explore chemical exfoliation. Chemical exfoliants include AHAs, alpha hydroxy acids like glycolic and lactic acid, BHAs, beta hydroxy acids like salicylic acid, and enzymes like papain from papaya and bromelain from pineapple. The main advantage of chemical exfoliation is controlled, even results. When you apply a chemical exfoliant, it works uniformly across your entire face. Every area gets the same level of treatment. This consistency produces more, even predictable results. Chemical exfoliation is gentler on your skin barrier. There's no physical friction or scrubbing, so you're not creating micro tears or damaging your skin through mechanical force. The acids simply dissolve the bonds between cells, allowing them to shed naturally. Chemical exfoliants can penetrate pores. BHAs, especially being oil-soluble, can work inside your pores to clear clogs from within. This makes them far superior to physical exfoliation for treating blackheads, whiteheads, and acne. Chemical exfoliation offers additional benefits beyond just removing dead cells. AHAs increase hydration, stimulate collagen production, and fade hyperpigmentation. BHAs have anti-inflammatory properties. These bonus benefits add therapeutic value. Chemical exfoliation is customizable. You can choose different acids, concentrations, and frequencies to match your specific needs and tolerance level. You have much more control over the intensity and effects. However, chemical exfoliation also has challenges. First, there's a learning curve. You need to understand different acid types, proper concentrations, pH requirements, and how to safely incorporate them into your routine. This takes research and patience. Second, chemical exfoliants require sun protection. AHAs increase sun sensitivity by removing that protective layer of dead cells. You must be diligent about sunscreen when using chemical exfoliants. Third, initial purging can occur, especially with BHAs. Existing clogs may surface more quickly, causing temporary breakouts before your skin clears. This can be discouraging if you don't understand it's a normal part of the process. Fourth, chemical exfoliants take longer to show results. While physical exfoliation provides instant smoothness, chemical exfoliation's deeper, more significant improvements take weeks of consistent use to become visible. Fifth, chemical exfoliants can cause irritation if used incorrectly. Starting with too high a concentration, using them too frequently, or combining them with other strong actives can damage your skin barrier. So how do you choose between physical and chemical exfoliation? Consider your skin type first. If you have sensitive, reactive, or acne-prone skin, chemical exfoliation is generally better. The gentle, controlled nature works better for delicate skin. If you have resilient, normal skin, either method can work, though chemical is still typically gentler. Consider your skin concerns. For dullness and rough texture, either method works. For hyperpigmentation and fine lines, chemical exfoliation, specifically AHAs, is more effective. For clogged pores and acne, chemical exfoliation, specifically BHAs, is far superior. Consider your lifestyle. If you're bad about sunscreen, chemical exfoliation isn't ideal for you. It increases sun sensitivity too much. If you want something simple that works immediately, gentle physical exfoliation might suit you better. If you're willing to invest time in learning and being consistent, chemical exfoliation often produces better long-term results. Consider your preferences. Some people love the ritual and tactile satisfaction of scrubbing. Others prefer the hands-off simplicity of applying a toner or serum. Honor your preferences. The best routine is one you'll actually follow. Can you use both methods? Yes, but carefully. Some people use gentle physical exfoliation once a week and chemical exfoliation 2 to 3 times a week. However, this increases the risk of over-exfoliation. If you combine both, start conservatively and monitor your skin closely. If you choose physical exfoliation, follow these guidelines. Choose gentle exfoliants with smooth, round particles. Avoid harsh scrubs with irregular, sharp particles. Konjac sponges, jojoba beads, and fine rice powder are good options. Use light pressure. You should never scrub vigorously. Gentle circular motions with barely any pressure are sufficient. Limit frequency. Once or twice a week is plenty for most people. Daily physical exfoliation is almost always too much. Avoid scrubbing active acne, inflamed areas, or open skin. Never scrub if your skin is sunburned, windburned, or otherwise compromised. Follow with hydrating, soothing products to support your barrier after exfoliation. If you choose chemical exfoliation, follow these guidelines. Start with low concentrations and build up slowly. Patience is crucial. Use acids on clean, dry skin for best results. Always follow acids with moisturizer to support your barrier. Use sunscreen diligently every morning. Monitor your skin for signs of overexfoliation, redness, burning, excessive sensitivity, or shiny, tight skin. Don't combine multiple strong actives without understanding how they interact. The ultimate truth? For most people, properly used chemical exfoliation produces better, longer-lasting results with less risk of damage than physical exfoliation. However, very gentle physical exfoliation used occasionally, carefully, can be a pleasant addition to a routine. The worst approach is aggressive physical exfoliation, harsh scrubs used frequently with vigorous pressure. This damages skin far more than it helps. As we close, remember that exfoliation is just one tool in your skincare toolkit. It's not mandatory. If your skin is healthy, comfortable, and you're happy with it, you don't need to exfoliate at all. Your skin will shed cells naturally, but if you want brighter, smoother skin, proper exfoliation can help. Choose the method that fits your skin, your concerns, and your lifestyle. Use it wisely, gently, and consistently. Take a deep breath in and release it slowly. Trust yourself to make the right choice for your unique skin. May you find the exfoliation method that serves you best. May you use it with wisdom and gentleness.
Mấy giờ ngoan?
Dạ 6 giờ rưỡi.
Nằm yên nha. nhìn sắc này cô đó nhiều à. Sắc đây không? Sắc đây. Cố gắng thế này, mụn chỗ này của con bị viêm trơn rồi nè, cố gắng tí. Ok. Này cứng hay nhức không?
Dạ hơi hơi hơi.
Nó cứng vậy là nó bị viêm tụ máu ở phía trong.
Mới đã hoa hay à?
Cô em lần đầu đi lấy mụn hả?
Dạ em lần đầu.
Ừ. Mấy cục này nó viêm nè. Đó. Nó mủ trong đây, nó bị tụ máu trong đây. Viêm lên kìa. Đây nữa. Rồi.
Mấy cục nữa giống vậy không?
Ừ?
Bao nhiêu cục phải chích cái đầu cái đó?
Hết rồi.
Vẫn còn nữa chắc chết quá.
Chích nhanh mà. Anh em là ở quận mấy ha?
Dạ em ở bên Thanh Đa, còn em ở bên Thủ Đức.
Dạ.
Từ từ có người gọi. Alo. Từ từ em đang nặng để phải hỏi. cho em nhìn em cái ha.
Xong rồi.
À dạ.
Ủa bé nữa xong chưa Kim Anh? Bán thời gian để người nhà qua đón.
Bên kia sắp xong chưa chị?
10 phút nữa xong rồi.
10 phút nữa là beo xong hả hai? Lúc đó là mới lấy mụn xong hay là có máy rồi xong hết?
Xong hết rồi.
Xong hết luôn đó chị hai? À.
Còn cục này nữa thôi. Rồi.
Hello. Em không có biết luôn, nãy em không kiếm, em thấy em mới đi xe 50 của em á. Kiếm gì? Gắng tìm đi. À.
Rồi, có mấy cục chỗ này. Sắp xong.
Ngồi dưới. Alo. Rồi. Ai da. Beo. Địa chỉ em là gì? Để chị mượn đặt xe về cho em về.
Acne resistant to standard topical treatments, particularly if inflammatory and deep, often reflects hormonal causes. Women with other hormonal symptoms, irregular periods, excessive hair growth, hair loss, fertility issues, should definitely pursue hormonal evaluation. Primary hormone involved in acne is androgen, particularly testosterone and DHT, dihydrotestosterone. However, most women with hormonal acne have normal total testosterone levels but exhibit heightened skin sensitivity to androgens. This explains why some women with normal hormones still have significant hormonal acne. It's about skin sensitivity, not absolute hormone levels. Relevant hormonal tests for acne evaluation include total testosterone, free testosterone, calculated or direct measurement, DHT, dihydrotestosterone, DHEAS, dihydroepiandrosterone sulfate, LH, luteinizing hormone, FSH, follicle-stimulating hormone, and androstenedione. These tests assess androgen status and ovulatory function. Additionally, tests for other hormones affecting acne include estradiol, progesterone, tested in luteal phase for ovulation confirmation, cortisol, for stress-related endocrine effects, and thyroid function, TSH, free T4, may be relevant. Ovulatory dysfunction, present in conditions like PCOS, contributes to hormonal acne. PCOS involves elevated androgen production, irregular ovulation, and insulin resistance. Women with PCOS typically have irregular periods, acne, hirsutism, excessive hair growth, androgenetic alopecia, pattern hair loss, and often obesity. Testing for PCOS is appropriate for women with these symptoms. PCOS diagnosis requires ovulatory dysfunction, irregular periods, plus hyperandrogenism, elevated androgens or clinical signs, and/or polycystic ovarian appearance on ultrasound. Baseline hormonal testing during the follicular phase, first 7 days of menstrual cycle, is standard because hormone levels are more stable and baseline during this phase. FSH and LH are assessed during the follicular phase. Progesterone is tested during the luteal phase, typically 7 to 8 days after ovulation, to confirm ovulation occurred. Testing hormone levels at the wrong cycle phase produces misleading results. Understanding test results requires expert interpretation because normal ranges vary widely and what's normal for general population might indicate androgen excess relative to individual baseline. A testosterone of 50 ing/dL is normal for most women but might represent significant elevation for a particular individual. Free testosterone is often more clinically relevant than total testosterone because it represents the active hormone, though measuring free testosterone is technically challenging and prone to error. Elevated DHEAS, particularly if greater than 350 μg/dL, suggests adrenal androgen excess and warrants further adrenal evaluation. Elevated androstenedione suggests adrenal or ovarian androgen production. Elevated LH with normal or low FSH suggests ovulatory dysfunction characteristic of PCOS. If hormonal testing reveals significant androgen excess, additional testing might assess the source. Adrenal tumors or ovarian tumors very rarely cause acne but can cause very severe hyperandrogenism. Evaluating clinical presentation helps distinguish adrenal from ovarian sources. ACTH stimulation testing can differentiate adrenal from ovarian androgen excess if warranted. Interpreting results in clinical context is essential. You might have borderline elevated testosterone with classic hormonal acne, jawline breakouts, cyclical pattern, making hormonal treatment appropriate despite normal lab values. Conversely, you might have elevated testosterone labs without significant acne, making hormonal treatment unnecessary. Clinical presentation guides treatment more than isolated lab values. When to pursue hormonal evaluation, irregular or absent menstrual periods, acne with cyclical menstrual pattern, acne onset in adulthood, acne concentrated on jawline and lower face, acne resistant to standard treatments, signs of hyperandrogenism, hirsutism, hair loss, male pattern baldness, family history of PCOS or hormonal disorders, concerns about fertility. Other reasons to evaluate hormonal status. Additionally, Pursuing evaluation before starting hormonal treatments gives baseline data to assess treatment effectiveness. Working with appropriate clinicians, gynecologists are ideal for hormonal evaluation in women, though some dermatologists also perform this evaluation. Reproductive endocrinologists specialize in hormonal disorders and are appropriate referrals for complex cases or 𝑭𝒂𝒄𝒊𝒂𝒍 evaluation. Family medicine physicians can perform initial evaluation. Choosing a clinician experienced in hormonal acne and 𝒂𝒄𝒊𝒂𝒍 improves evaluation quality. After hormonal evaluation, appropriate treatment depends on findings. If 𝒂𝒂𝒄𝒊𝒂𝒍 is confirmed, treatment includes hormonal contraceptives for acne and period regulation, spironolactone, antiandrogen, metformin for insulin resistance, and lifestyle modification. If adrenal androgen excess is identified, dexamethasone might be considered. If results are normal despite hormonal acne pattern, empirical hormonal treatment, oral contraceptive or spironolactone, remains appropriate despite normal labs. Timeline for hormonal treatment effectiveness is months, not weeks. Hormonal treatments typically require 3 to 6 months to show acne improvement, with maximal improvement often occurring after 6 to 12 months. Patience is necessary. Discontinuing hormonal treatment after 2 to 3 months before full benefits appear is a common mistake. Reassessment after hormonal treatment initiation is valuable. Repeating key hormonal tests, particularly free and total testosterone, after several months on hormonal treatment confirms that the treatment is achieving hormonal effects. If testosterone hasn't decreased despite hormonal treatment, investigating why, medication noncompliance, inadequate dosing, ineffective treatment choice, is appropriate. Guide 38, Dietary Supplements for Acne, Evidence-Based Review of Oral Supplements. Numerous dietary supplements are marketed for acne with varying levels of evidence. Understanding which supplements have evidence, realistic expectations for supplementation, and appropriate dosing guides inform decisions about supplementation. Zinc supplementation has evidence for acne improvement, particularly in individuals with zinc deficiency. Zinc supports immune function, wound healing, and inflammation reduction, all relevant to acne. Studies show that oral zinc at 30 to 50 mg daily improves acne moderately. However, excessive zinc supplementation, above 150 mg daily long-term, causes nausea and interferes with copper absorption. Typical zinc supplementation is 25 to 30 mg daily. Zinc is more effective for those with demonstrated zinc deficiency, though some people without deficiency also benefit. Blood zinc levels can be tested to assess zinc status, though zinc testing is not widely available. Vitamin D supplementation shows promise for acne. Vitamin D has immune and anti-inflammatory effects relevant to acne. Low vitamin D levels correlate with worse acne. Vitamin D supplementation at 1000 to 400 IU daily might improve acne, particularly in those with low baseline levels. However, evidence is mixed, and benefits are modest. Vitamin D supplementation is generally safe and supports overall health beyond acne, making it reasonable to consider. B vitamins, particularly B5, pantothenic acid, are promoted for acne. Pantothenic acid is marketed at very high doses, 10 grams daily, claimed to reduce sebum production. While some small studies suggest benefit, evidence is weak. High-dose pantothenic acid causes diarrhea frequently and benefits aren't reliably demonstrated. supplementation is not recommended without stronger evidence. Omega-3 fatty acids, fish oil supplementation, support anti-inflammatory effects and improve acne in some individuals. Omega-3s reduce systemic inflammation and support skin health. Typical supplementation is 1 to 2 grams daily of combined EPA and DHA. Fish oils